This is the rare variety of ASD, that is sinus venosus ASD of IVC type. Very rare finding. So this kind of ASD is often missed by most of the person, because if you don't know the real view in which you can find this kind of ASD. So what you see, right atrium, right ventricle severely dilated, indicating some sort of ASD in this case. Again you see the same thing. You see the right ventricle severely dilated, left ventricle D-shaped, indicating raised right ventricle systolic pressure, indicating severe pulmonary artery hypertension. Again you see the same things, pulmonary artery dilated. You can see the mild to moderate tricuspid regurgitation jet. This is TR jet. This is bicable view. In this bicable view, what you see, this is IVC, and this is SVC. This is left atrium, and this is right atrium. So ultimately what you see in this image, left atrium is communicating with right atrium. You see that this portion, there must be some sort of atrial septum here, if there was no ASD in this case. So if you know this case has ASD, so this portion is deficient, and deficient portion is in contact with IVC. So this is sinus venosus ASD of IVC type. You see this SVC is draining into right atrium, and this margin, this is the SVC margin, is intact. This is left atrium, this is SVC, and this is right atrium, and this is the margin, that is anterior septum. This is anterior septum is present between right atrium and left atrium, where the SVC drains into right atrium. So this is not the type of ASD of SVC type. This is the ASD of IVC type, because this is IVC, inferior vena cava. This portion is left atrium, this portion is right atrium, and there is no anterior septum here. So this is very large ASD of IVC type, sinus venosus ASD of IVC type. This kind of ASD is very rare. Whenever you get this bicable view, you will find either ASD of SVC or IVC type of sinus venosus ASD very easily. How to obtain this view? You know, this is subcostal view. The plane is sagittal plane. So try to make IVC and SVC in same plane, obviously in sagittal plane. So IVC is situated slightly right of the spine. So slightly right of a spine, just in the sagittal plane. Keep the probe in sagittal plane. This is the direction of the probe. This is the P. You see the P indicates the direction of probe is towards the SVC, that means towards the head. This is the inferior part of the image, this is towards this side. So this is your left skin, this skin is your left side, this is IVC, this right part of the skin is your SVC, because your probe has to be like this. The probe is directed towards cranium. So ultimately this portion shows SVC, superior vena cava, and this portion is IVC, inferior vena cava. This is right atrium. Right atrium has to receive IVC and SVC. So this is IVC, this is SVC, and this is left atrium. You can see this is a right lower pulmonary vein draining directly into right atrium. You see where the IVC also drains. You see. So whenever you find sinus venosus ASD, there must be partial pulmonary venous connection. In case of sinus venosus ASD of IVC type, right lower pulmonary vein will drain directly into right atrium along with IVC. In case of sinus venosus ASD of SVC type, you will find right upper pulmonary vein draining directly into right atrium along with SVCC. or you can say draining into SVC and then draining into right atrium, because both are very close to each other. The only point to know, whenever you do not find ASD in normal position, normal views, a 4-chamber view, in that case you have to search sinus venosus ASD. Very easy to find sinus venosus ASD in bicaval view. Bicaval view is made in subcostal plane, subcostal window, in sagittal plane. Just keep sagittal plane, try to find out IVC and SVC in one plane. Then this is the part that is close to probe, that is right atrium, that is probe, the part of the image that is away from the probe, that is left atrium. You are seeing through subcostal plane that the probe position is superior. The probe has to be directed towards your cranium, that is towards the head of the patient. So this will be the SVC, this will be the IVC, and this is the right atrium, this is left atrium. And you always find this kind of ASD. You will never miss sinus venosus ASD in this bicaval view. This kind of ASD is often missed, so you will not miss. If you make bicaval view, whenever you find right atrium, right ventricle enlarged, and you do not find the cause of right enlargement, right atrium, right ventricle, in that case try to find out ASD. If you do not find ASD in normal position, then try to make this bicaval view. In bicaval view you will not miss ASD of sinus venosus type, either SVC or IVC type. Moving to the next image, again the same thing. You can see the flow. This is the flow from right lower pulmonary vein directly into right atrium. This is IVC, this is SVC, this is SVC. Any communication draining right atrium, SVC. Any communication directly into draining into right atrium from this side, this is IVC. This is hepatic vein. Next image, again you see that the whole ASD and flow from left atrium into right atrium. You see the red flow. This is left atrium, this is right atrium. You can see the large ASD of sinus venosus type of IVC sinus venosus. You see in this image you do not find ASD. The typical image, typical ostium secundum ASD is seen in this view, but you are not finding any ASD here in this image. That is why you have to make bicaval view. In that view you will always find ASD of sinus venosus ASD of either IVC or SVC type. Sinus venosus ASD of SVC type is common compared to IVC type, so this ASD is very rare. Again you see the ASD is not commonly seen. This is the commonest view in which you find ostium secundum ASD. Here the position, this is right atrium, this is right atrium, this is left atrium, and this is internal septum. I don't find any ASD here, but the patient has got right atrium, right vein severely enlarged, severe PAS. So ultimately ASD has to be seen in this case. So you make bicaval view and you will find ASD. Again you see right upper pulmonary vein draining into you see this right upper pulmonary vein draining into left atrium. Right upper pulmonary vein is draining into left atrium. So sinus venosus ASD of SVC type is not there, because in that case right upper pulmonary vein is not draining into left atrium, it is draining into right atrium along with SVC. In this view you can find, again this is IVC and this is the ASD. You can see the flow through ASD. This is you can say modified bicaval view. It's not a typical bicaval view, but it's close to that of bicaval view. You can find the ASD. This is again, this is the left atrium, this is right atrium, and this is IVC. You see the in this image. So ultimately I think it will be easy for anyone to find out sinus venosus ASD, that is very uncommon ASD. Same thing, bicaval view, So ultimately this is sinus Venosus ASD of IVC type, right lower pulmonary vein draining into right atrium along with IVC, that is partial anomalous pulmonary venous connection, right atrium, right ventricle severely dilated, mild to moderate TR, severe PS, LV chamber D-shaped. So ultimately this case has got severe PS. Case has to be closed very early so that patient does not develop Eisenmenger syndrome. Though we have to calculate pulmonary vascular resistance. If pulmonary vascular resistance is less, then case can be operated. If pulmonary vascular resistance is high, inoperable, then case cannot be taken for the surgery. Thank you.